Module 9 of the 6th edition Manual of Procedure for the National TB Program is about active drug safety monitoring and management. At the end of the session, participants should be able to explain aDSM system and essential components in aDSM, define aDSM, adverse event, adverse drug reaction, the challenge and the challenge. Also, to identify the different packages in aDSM reporting and the package of choice by the Philippines. Also, to recognize SAE and AESI. To report SAE and AESI by using FDA suspected adverse reactions form, known as the aDSM reporting form. Okay. The active and systematic clinical and laboratory assessment of DRTB patients while on DRTB treatment with new drugs. This includes DRTB regimen containing bedaquiline and delamine. It is recommended for pharmacovigilance, active monitoring, and management of adverse events as one of the 5 conditions to be met when using these drugs to treat DRTB. The 5 conditions that must be in place if delamine is used to treat adults with MDR-TB are the following. Number 1, proper patient inclusion. Special caution is required when delamine is used in people ages 65 or older, in adults living with HIV, patients with diabetes, hepatic or severe renal impairment, or those who use alcohol or substances. Using pregnant and breastfeeding women and children is also not advised. Number 2, adherence to WHO recommendations when designing MDR-TB treatment regimens. When delamine is included in treatment, all principles on which WHO recommended MDR-TB treatment regimens are based must be followed, particularly the inclusion of 4 effective second-line drugs as well as pyrazinamide. Delamine should not be introduced alone into a regimen in which the companion drugs are failing to show effectiveness. Number 3, effective treatment and monitoring. Treatment must be closely monitored for effectiveness and safety, using sound treatment and management protocols that have been approved by the relevant national authorities. Number 4, pharmacovigilance and management of adverse events. Active pharmacovigilance measures must be in place to ensure early detection and proper management of adverse drug reactions and potential interactions with other drugs. And number 5, informed consent. Patients must be fully aware of the potential benefits and harms of the new drugs and give informed consent before embarking on the treatment. These are the 5 conditions that should be in place when using the new TB drugs. The letter B, novel MDR-TB regimens. These are the SSOR, which stands for Standardized Short Oral Regimen, and SLOR, which stands for Standard Longer Oral Regimen. It is recommended that there should be an active monitoring and management of adverse events. And lastly, XDR-TB regimens. Most XDR-TB regimens will be individualized treatment regimen, or what we call the ITR, and soon there will be BPAL as last resort for treatment. And then, another aDSM and management policy is to detect, manage adverse events, and report suspected or confirmed drug toxicities. Because as we all know, these are new drugs, no? So there are adverse events that might be expected when using these drugs. Okay. Another is essential component in DRTB DRTB. One of the key activities in aDSM is the reporting of all serious adverse events, or the SAE, and adverse events of special interest, which is the AESI. But it should be noted that active clinical and laboratory monitoring of patients for surveillance of any adverse events and prompt and immediate management of adverse events, regardless of severity, are equally important. Whether minor or major adverse events, it should all be reported and treated as equally important. Okay. So procedures on how we do the aDSM. Number 1, report all ASEs or AESIs through the prescribed reporting form or system. So we have the FDA recommended form, and then complete the report through PVIMS. In case PVIMS is not accessible, the staff should complete the FDA suspected adverse reaction form. This paper report shall be submitted to the Center for Health Development, regional NTP coordinators, and the National Drug Policy Compliance Officer. This shall be later entered into the PVIMS by NDPCO. Through PVIMS or paper format, submit the report within 2 working days from occurrence of event or immediately upon receipt of the information. For example, if the health personnel was notified more than 3 days no, so the staff must immediately report the SAE or AESI upon receipt of the information, but ideally it should be reported within 2 working days. Okay? And then manage all adverse events accordingly. So before we proceed, let's define some terms muna. What's the difference between adverse events and adverse drug reactions? Adverse event is a negative or harmful health experience that occurs during the treatment, which may or may not be associated with the medicine. While adverse drug reaction, or ADRs, are harmful effects suspected to be caused by a medicine when used at normal therapeutic doses. Okay. Serious adverse events, these are any untoward medical occurrences at any doses. When there is a serious adverse event, it may require a drastic intervention, such as termination of the drug suspected of having caused the event. It usually requires to be reported within 2 days, as mentioned earlier, except for death, which shall be reported within 24 hours. So, SAEs may be one of the following, one or more of the following. Results in death, is life-threatening, requires inpatient hospitalization, or results in prolongation of existing hospitalization. It can also be results in persistent disability or incapacity, is a congenital anomaly or birth defect, or adverse events that do not immediately result in one of the above outcomes, but which require an intervention to prevent a serious outcome are included. On the other hand, adverse events of special interest are adverse events documented to have occurred during clinical trials and for which the monitoring program is specifically sensitized to report regardless of its seriousness, severity, or causal relationship to the TB treatment. These are the following. It may be acute kidney injury or acute renal failure, hepatitis, as defined as increased ALT or AST that is 5 or more, that is more than or equal to 5 times the upper limit of normal, or increases in ALT or AST that is greater than or equal to 2 times upper limit of normal with clinical manifestation, or increases in ALT or AST more than or equal to 3 times ULN with concomitant increase in bilirubin that is greater than or equal to 1.5 times the upper limit of normal. Okay. It also includes hypokalemia, myelosuppression, as manifested as anemia, thrombocytopenia, neutropenia, and leukocytopenia. Also includes optic nerve disorder called optic neuritis or retinopathy. Also ototoxicity, which includes reading impairment and loss of any degree. It also includes pancreatitis, peripheral neuropathy, or the paresthesia, prolonged QT interval, or the Liderisha correction of more than 500 ms or more than 60 ms increased from baseline. It also includes psychiatric disorders and central nervous system toxicity such as depression, psychosis, suicidal intentions, and seizures. So we go back to definition of terms. Casualty assessment. This is the evaluation of the likelihood that a kidney medicine is the causative agent of an observed adverse reaction. The challenge, it is a withdrawal of a medicine from a patient following an adverse event. So we have a positive and negative the challenge. For positive the challenge, these are the adverse events which resolves following withdrawal of medicines. While negative the challenge, the adverse events continues despite withdrawal of medicine. The challenge is defined as the reintroduction of the medicine following withdrawal and recovery from the adverse events. Positive challenge, the adverse events recurs, while on negative challenge, the adverse events does not recur. The Department of Health issued Department Memorandum number 2020-0177, which reiterates the policy on the implementation of active TB drug safety monitoring and management sa AESI. So this department memo is all about the reiteration of the implementation of the aDSM. It was released last April 21, 2020, signed by Undersecretary Mirna C. Kabutay. In this policy, the health workers in health facilities providing DRTB treatment shall perform the following. Promptly detect the occurrence of adverse events through the conduct of baseline and follow-up clinical laboratory and diagnostic tests. Number 2, properly manage all adverse events in timely manner. Number 3, record and report all serious adverse events and adverse events of special interest using the prescribed NTP form and FDA suspected adverse reactions form. To further guide healthcare workers and treatment supporters in monitoring the occurrence of adverse events in DRTB patients on treatment, the aDSM checklist shall be utilized either in person, via phone, or by other means of communication. In the new normal are other means of communication, including teleconferences, no? And then, this checklist shall be administered at least weekly for the first 2 months for newly enrolled patients, and then every 2 weeks for patients already on treatment for more than 2 months. The patients shall also be advised and encouraged to voluntarily report any occurrences of adverse events in between these intervals. In the light of the community quarantine being imposed in different areas nationwide, NPPMO created the aDSM checklist provided in Annex C. So, this will guide healthcare workers and treatment supporters in monitoring occurrences of adverse events in patients using different means of communication. This is how the Annex C looks like. Okay. Observe and or ask patients for the following signs and symptoms. No, just mark it with a check whether it is applicable or not. If it's applicable, yes. If not, no. So just ask the patient what he or she is experiencing. If yes to any of the signs and symptoms, no, the treatment supporter should refer the patient's case to the healthcare worker in charge for proper advice and further guidance. And for healthcare workers, provide proper advice and further guidance. So we have here fever, cough, with blood, shortness of breath, yellow discoloration of skin and or eyes, and pale lips and or fingers and palms. Checking for adverse events, the healthcare workers or the health treatment supporter should ask if the patient have any signs of nausea, vomiting, abdominal pain, notice yellowing of eyes or skin, have had diarrhea, or had pain or burning in the legs, or had any changes in vision, or if the patient had experienced any hearing loss, any dizziness, vertigo, or tinnitus, any leg cramping, or does the patient feel weaker than before? Does the patient get easily tired than before? Or does the patient have had any fainting or lightheadedness? Another questions to be asked are, does the patient feel pounding or racing or slowness of heartbeat or fluttering in the chest? Um, does the patient has any loss of sleep or sleep disturbances during treatment, or has had any instances of headache, or does the patient feel sad, or does the patient have any chest pain, or does the patient have any signs of not worth of living? No, so these are the red flags that we should be at asking the patients. No, or does the patient feel anxious or agitated? Or does the patient hear any voices or see things that may not be there? So there has hallucination ba, or does the patient experience any convulsions or seizures or does the patient have any rashes or any joint pain? So these are the questions to be asked by the health workers in assessing for any adverse events. Okay, that was the English version, and we also have the Filipino version. So DOH issued an administrative order number 2020-00225. It is the policy and guidelines and implementation of active drug safety monitoring and management of the NPP dated June 2, 2020. The AO contains the rationale of this AO. The aDSM implementation is an integral component of the comprehensive package of TB services that will be provided to all patients with TB using new anti-TB drugs, a repurposed drug, or a new regimen. The purpose drug, This is a drug that is recommended by WHO for use in the treatment of TB, but was approved by a regulatory authority for the treatment of other infectious diseases. So, this is what we call the off-label use of medications. And then, this is aligned with the goal of the Universal Health Care Act to provide comprehensive, quality, and cost-effective healthcare services for all. And one of the key strategies to support the realization of the goal of the Formula One class to achieve better health outcomes, particularly for the patients with TB. The objective of this AO, because it aims to strengthen the implementation of aDSM in the country, is to provide policies and guidelines on the implementation of aDSM for all patients with TB using new anti-TB drugs, a repurposed drug, or a new regimen, because we all know TB bacilli is evolving, and the newer drugs are being studied and then being manufactured for the use of treating TB. Specifically, this AO defines the roles and responsibilities of TOH officers, stakeholders, and partners involved in the implementation of the aDSM system in the country. It also provides guidelines for the establishment of partnership with LGUs and hospitals in implementing the aDSM in the country. And it also standardized data collection and processing of adverse events reports from the implementing health facilities to further assess the safety of a new drug, a repurposed drug, or a new regimen for DRTB. The scope and coverage of this LAO includes this order shall apply to all health facilities, both public and private, and health professionals providing treatment to all patients with TB using a new anti-TB drugs, a repurposed drug, or a new regimen. The DOH concerned offices, Center for Health Development, Ministry of Health, Bangsamoro Autonomous Region in Muslim Mindanao, all LGUs and other stakeholders involved in aDSM. So everyone involved in providing TB services are covered in this administrative order. What are the roles and responsibilities? Okay. Number 1, identify promptly the occurrence of any adverse events and manage properly all identified adverse events. The earlier it is reported, the better. Collect and encode the reports of serious adverse events and adverse events with special interest into the PBIMS or any of the prescribed web-based reporting system. Report all SAEs and AESIs to the FDA Pharmacovigilance Unit and National Pharmacovigilance Center using the approved prescribed reporting forms and system. Also, coordinate with the CHD or MOH BARM through the NDPCO designates or assigned DOH hired pharmacists for the encoding of reports to PBIMS or any prescribed web-based reporting system. Another roles and responsibilities include analyze all data generated from implementation of aDSM at the facility level. Also, educate patients to monitor their own clinical condition following administration of new drugs. As early as the start of treatment, patients should be counseled that any adverse events or anything that they might feel during the course of the treatment should be reported immediately to their treatment supporter or health personnel in charge of their treatment. Okay. Also, maintain integrity and transparency of records and make data available to both the DOH and FDA. This is very important because we would like to monitor the effectiveness of the drugs. So if there are any adverse events, and we should also want to protect the patient. So if there and prevent further harm for the patient. So if there are any SAEs or AESIs, regardless of the severity, it should be reported immediately. And then number 8, participate in a case investigation of suspected adverse events. So the aDSM, this slide shows the aDSM packages. The package chosen by the Philippines is the intermediate. So it includes all SAEs and AEs of special interest. So the 3 levels of monitoring described as 4, intermediate, and advanced. So the Philippines chose the intermediate. This is to report all SAEs and AEs of special interest. Okay. So the essential activities for aDSM includes the following. Active and systematic clinical and laboratory assessment during treatment to detect drug toxicity and adverse events. So the question to be asked is, are we following the schedule of treatment monitoring? And then number 2, management of adverse events in a timely manner. The question we should ask, are we providing care to our patients? And then number 3, systematic collection and reporting of standardized data for SAEs and AESI. So the question here is, are we following the guidelines on reporting and recording? We should also ask, is adverse event reportable? The answer is yes. All adverse events or adverse events of special interest should be reported. Okay, to whom does aDSM apply? This applies to all TB patients receiving new anti-TB drugs, novel MDR-TB regimens, and extensive drug-resistant TB regimens. So, what are the new anti-TB drugs? Examples are daquilin, or what we call the, or what we know as the BDQ and the bilamine. These are the new anti-TB drugs. And then the novel MDR treatment regimen includes the SSOR, stands for Standard Short All Oral Regimen. It is a 9 to 11 month treatment duration. And then the Standard Long Oral Regimen, it is usually 18 to 20 months treatment duration. And then it also includes extensive drug-resistant or XDR-TB regimens. So most XDR regimens will be individualized treatment regimens. In the Philippines, all MDR-TB and DRTB XDR patients, including those receiving individualized treatment regimen, so sila yung included. So, what should be reported? Okay. The serious adverse events are any untoward medical occurrences at any dose, no? Which would result with the following enumerated items. And then adverse of special interest are 10 items listed. It was mentioned earlier where to report. So we should remember these email addresses. So pharmacovigilance@fda.gov.ph and the npp.pharmacovigilance@gmail.com and then dohpdpimu@gmail.com can also include the regional DOH email address. For Region 9, it is nppchtzp@gmail.com. The subject of the email should be SAE and AESI reporting. And then for updating of cases, please submit on the same email thread or indicate document tracking number provided by FDA for easier tracking of the report. When to report, okay? Serious adverse events should be reported within 2 days from notification of the serious adverse events, or when there is death, it must be reported within 24 hours. While adverse events of special interest are to be reported within 2 weeks, but the earlier, the better. Practical hints for aDSM reporting. So, may mga bibigay silang hints noon doing the aDSM reporting. The staff can start with filling a brief and minimal essential information such as the specific adverse event, lab result, the relevant baseline, and at the time of the adverse event. So, at any other cause or morbidity that would contribute to adverse events, or any concomitant medicine taking at the time of occurrence of the adverse events. So, these are the baseline information that is needed in aDSM reporting, no? And for example, hypokalemia on October 20, 2019, open close, AESI, no anti-TB drug was stopped, replaced oral A plus tablet, no hospitalization, no other cause of hypokalemia, not taking any other concomitant medication. And then in lab section, 2.5 mmol per liter, baseline potassium at the start of treatment, 3.9 mmol per liter. So that's one way of writing the report. No, and then we also have another example. Refer patient to the hospital for blood transfusion and hospitalized 2 days on October 17 to 18, 2019. Open and close. Parenthesis SAE. In the lab section, HP is 7.2 grams per DL. And the baseline hemoglobin at start of treatment is 12 G per DL. No other cause of anemia, not taking any other concomitant medicines. Linolazolid, time to reintroduce 300 milligrams after recheck CBC is received. Another example is patient died at home while in toilet. Here SAE. Casualty Assessment Committee may ask last ECG done, last electrolyte test result, last blood sugar level, last TSH level, any history of hypertension, heart disease, example myocardial infarction, diabetes, and other non-TB medication patient was taking, etc. Okay. Important points to keep in mind while doing the aDSM. It is not reporting medical error or to use as medical legal tool. It will not be used for reporting any medical error. No, it is solely to monitor any adverse events that will affect the treatment of the patient. And then, should also keep in mind that reporting does not need to be the event likely related to anti-TB drugs. Also, we'll know only after casualty assessment if it is likely. We cannot say definite in majority of cases related to any anti-TB drugs regimen. Adverse events may be due to other drugs taking for SE management or comorbidity or progression of TB disease itself. Also, keep in mind that if the finding from causality assessment is likely related to anti-TB drugs, usually it is due to at least one drug, since many drugs have similar side effects. Okay. Reminder for all adverse events should be managed clinically, but only serious adverse events and adverse events of special interest will be reported to the national authority. So if the adverse event experienced by the patient is not in any of the serious adverse events or adverse events of special interest situations as listed earlier, it should not be reported and should be managed clinically. But if it falls under the event falls under SAE or AESI, it should be reported immediately. How do we fill out the FDA suspected adverse reaction form or the aDSM reporting form? So the form has 5 parts. Number 1 part is about the patient. The second part is about the adverse drug reaction. The third part is the suspected and concomitant drugs. Number 4 is the other information. And number 5, the reporter. This form is downloadable at https://www.fda.gov.ph/articles/articles/55084 So it can be downloaded at the website of the FDA. Okay. So for our example, the detailed the report, the better. Okay. The reporter, before submitting the report, should affix his or her signature and note the date, write the date when the report was done. Also include the personal information, the contact number and email address, the profession, and the facility of the reporter. For your references, you may refer to the National TB Control Program, Programmatic Management of Drug-Resistant TB Implementing Guidelines of 2016, and the Active Tuberculosis Drug Safety Monitoring and Management Framework for Implementation, WHO Publication 2015. So if there is no questions, you may proceed in answering the exercise, which is reporting on severe adverse events and adverse events of special interest. Thank you.